Hello everyone, my name is Dr. Vijay Bhatia and today I'm going to talk about insight in mental illness. What is insight in mental illness? Insight may be defined as awareness of one's own medical condition or mental health condition. It is difficult to achieve since it involves some knowledge of what constitutes a healthy mind. Insight is not simply present or absent, but rather a matter of degree. The point here is about the awareness. Awareness is about having the understanding that you are likely to know the position, the situation, the circumstances, and behaviors, moods. You know yourself and you know that you are not the same, you are different. Do you have that awareness that I am behaving differently? I am feeling differently than I used to be. There's a change in behavior, in the emotions, in the mood. Are you fully aware of yourself? Normally in mental health, other people notice the behavior, that there is some change in the way the person is dressing, the way the person is behaving, and if that behavior is persistent and that is not him, that is not the way we know him, he is acting and behaving in a very, very different way. There must be something going on. But does the person themselves understand those phenomena as well? And being aware of those changes or those things is going to tell us whether the person has insight. And again, as we said, it is not just a present or absence of insight, but rather a matter of degree, how much insight they have. How far the patient is aware of the morbid nature of his experiences. Let's take of an example of uh, maybe low mood. Patient is feeling low in mood and it has been going on for at least a month and he lacks energy, he's not doing the things he would normally enjoy. Does he fully aware that he is having these changes and they are morbid in a way, that they are not normal in a way, that there must be some kind of illness attached to it rather than just feeling that way? That will constitute how much insight he has. Normally people will give different reasoning, that I'm feeling low in mood because I had a bad food, I had a flu, or I have some other problems, my family is not right, or somebody has passed away in the family. But to some degree that can be understandable. Yes, you can have those symptoms, but if the degree gets quite severe and you don't enjoy at all anything for days and weeks, many a times the person is not fully aware, whereas the others, closed and loved ones, they become more aware of that there is definitely a change and person needs help. So it's not only with the mood, but it can be anything. It can be opposite. The behavior is getting very erratic, very reckless, impulsive, and it is not one-off. It is keep on going for days and weeks. Same with the mood. The mood can be very high, very elated, as if you have a lot of energy, you can do anything, you can enjoy anything, you are jovial all the time. Are you fully aware of that? That could be part of the mental illness or part of something morbid process going on inside your body. That's why you're feeling that way, because normally you wouldn't feel that way. This applies to actions, reckless behaviors, gambling, drinking, um, uh, driving fast, and interaction with other people. How do you meet other people? If you're feeling very high, you might interact with any stranger or any person you meet, whereas if you are very low in mood, you may not even interact with close family members. So are you fully aware that these changes are happening and they have been present for some time, and that's normally shouldn't be there? And should it trigger some kind of thoughts that it could be an illness, and it could be about any other thing? People won't even have insight into their habits, or making judgments and making decisions, keep on buying lottery or keep on spending money in the gambling, and it could be about anything. In fact, any mental illness, like the person can be paranoid. Does the person know, is aware that they are paranoid, or they simply believe no, there is somebody real outside who is after them, therefore they are behaving like that, otherwise they wouldn't. There are four separate questions the psychiatrist normally asks to establish if the person have insight or not, or if the person has some degree of insight or more degree of insight or less degree of insight. These questions are concerned with the patient's opinion about the nature of his individual symptoms. So we ask the person, the patient, what is his opinion about the nature of the symptoms he is presenting. Let's take an example. For example, whether he believes that his extreme feelings of guilt are justified or not. In the first instance, does he even believe that he feels guilty? He may say yes. And when you ask him, are they justified? He may say yes or not. So he may answer this, yes, I know that I am feeling guilty, and I know that I've done something bad and I should be punished for that. And second question, does the patient feel himself to be ill rather than, say, persecuted by his enemies? So what happens here is, so in this case we ask, do you believe that you are feeling extremely guilty of what you have done? And he might say yes, or he might say no, because I have really done something. So it is not the feeling, it is the reality. And does the person feel himself to be ill rather than, say, persecuted? Does the person actually feel ill? Because we know that in depression, even if you have done something minor wrong, the guilt feelings can be too big, and it is not justified to feel that guilty for such a minor offense. So the person will say, yes, I feel guilty, but I do not believe that I am ill because I have done something really bad in my life. Therefore, I am supposed to be guilty and I am supposed to be punished, rather than saying, no, I'm not guilty. I haven't done anything wrong. They are persecuting me. They are after me to make me feel bad. Number 3, whether he thinks the illness is physical or mental. Let's say even up to this stage, he says, yes, I agree that there is something wrong. I'm not well. And then you ask, do you think the illness could be a physical illness or mental illness? Most of the time they put into the physical illness, like even I am too tired, I have been doing too much work, I feel exhausted, I haven't been eating, I've been drinking alcohol. So they put the physical rather than mental. In fact, when they are really depressed, they will have all these symptoms, and they will not recognize this. But even at this stage, some people will say, yes, doctor, I am depressed, otherwise I wouldn't be like this. I need some kind of help, and I need some kind of investigations or diagnosis or something. Otherwise, I don't feel like this. I've been feeling depressed for months. Number 4, and whether he sees himself as needing treatment. So even up to this stage, if he says, yes, I do believe that I am suffering from depression, then the question is, will you accept the treatment? And here again, no, I may not need any medication. This is a God's will, or this is the way in our culture is, or this is the way our society is. Sometimes we feel low, we will be all right, I will be getting a little bit more support, or people will be supporting him, or they will even take to some spiritual leader or religious leader, and they will look after them and he will be all right. But on the other hand, because it is a real mental illness and there is a need for real medical treatment, the person, there are very few people who will come to this stage. Yes, I do think that my symptoms could be because of mental illness, and that these could be part of the serious mental illness. And yes, because it is mental illness, there is a need for the treatment, and I will take that treatment. So first question, is the patient aware of the phenomena that other people have observed? We discussed this in more detail previously already. Here I'm taking a different example. For example, that he appears to be unusually active and elated. The person themselves may not realize, because they feel energetic, they want to do more things. They've been cleaning house, they've been doing shopping, they've been working hard, and they feel active, and he doesn't need sleep, he doesn't need much food, and he is fine. But does he recognize that this behavior is not usual him? This is unusually active and elated behavior. Will he recognize this phenomena could be due to anything which other people have observed, could be anything, something wrong with him, either physical or mental? That is number 1 question. Number 2 question, second question. So if he says that, yes, I do realize what others are saying is true, that is not me, I've been overly or unusually elated for last whole week and spending and driving fast and putting myself in trouble, he may say yes, that he is aware of the phenomena. Then does he recognize that these phenomena are abnormal? Does he actually understand that although this phenomena is happening, does he believe that it is abnormal? He might say, oh no, I'm fine, I've been doing this has happened to me before for a few days, then I will be alright. But does he recognize this as abnormal or not? And if he does, and he feels that way, so in this case, or does he, for example, maintain that his unusual activity and cheerfulness are merely normal high spirits? So it is important that he has the understanding that he recognizes the phenomena as abnormal and unusual for him. Question 3. If he recognizes the phenomena as abnormal, as we seen in the previous, does he consider that they are caused by mental illness as opposed to a physical illness? Or is it just the result of some poisoning administered to him by his enemies? So if he recognizes that he is behaving abnormal, which is not normal for him, and that has been going on for some time, could it be due to the mental illness, or is it possible that it is a physical illness, or does he actually think no, somebody is persecuting me, they have put something in my food and they are poisoning me, that's why I'm behaving like this. I am angry, I'm elated, I'm charged. Question 4. If all the previous question at the final thing that he accepts that he does have some kind of abnormal behavior and that is not him and that can be part of the mental illness, then will he take the treatment? Does he think that he needs treatment? Will he accept further investigations or blood test or cognitive test, whatever is required in order to help with this mental illness? Will he accept the treatment? Up to this stage, a lot of mental health patients lack the insight apart from the neurosis, which are mainly the anxiety disorders. In schizophrenia, psychotic illnesses, normally this part is normally not accepted. They do not think they have mental illness. So what is the importance of having insight in mental illness? As we said in the previous slide, that psychosis, we believe that they normally do not have insight. They do not even consider their phenomena as abnormal, let alone be a part of the mental or physical illness, or let alone they would require some kind of treatment. If they lack the insight, they are not likely to take the treatment, even if you prescribe them or other people persuade him to take some. They might take for a couple of days, but then because they don't think themselves as mental illness, therefore they are not likely to continue with the treatment. Whereas if they have insight, they may think that they are unwell and they would require treatment, and it will help them because it has helped them in the past. So that is the importance of having insight into mental illness. Thank you for watching this video. Please press the like button if you like the video and subscribe the channel for more videos on mental disorder and symptoms in mental health. Share with your friends. Thank you. I see you again in my other video.